We're live.
Some emojis. Hey guys, it's Dr. Emer, and we're doing end of the day. We're doing one of our favorite treatments. You guys know, facial sculpting. And what we're going to do today, a patient of mine who's done every so often we do little tweaks. He looks great already. We did a little lifting in his mid-face last time with some radius. And then this time, because he does actually really well with Restylane, using it just in the folds and around the mouth, we're going to do a little touch-up, which he hasn't done for years. It's done really well, but it's bothering him that he has a little bit in folds, and if you take a look at his overall face, he's a little wider here, but has a little bit less projection in the chin area. So we're going to, because as you age, this area comes down a little bit, you lose volume around the mouth, the corner of the mouth turns down, and you get this crease right here in the middle. So our goal is just to fill this slightly around to just give him some enhancement. So I'll just make it easy for him and not have a lot of downtime, because sometimes men tend to want to bleed a lot. We're going to use a cannula. So it's great. This area is really good. Turn a little left for cannula, because you can go right in the tissue with almost no pain. We can do a little tap, 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 and we're right there in the deeper area of the fold. And we just go nice and slow. And we get that to rise. Now, a lot of what is happening as we age, why we get folds, is because the cheek area tends to come down a little. But the thing is, you don't want to overdo the cheeks. When he smiles, he actually has a lot of volume there. So our goal is to actually give him some volume directly in the fold. And Restylane, he likes from the past. It has a little more substance to it, and will hold this area for him, I think, pretty well. Okay, we'll do a little blending, a little softening there. You can see now what I'm going to do with that little extra bit. Perfect. I'm going to come right to the corner of the mouth, because that's an area that he's noticing some issue. And, hold on, I may need that back. Let's see, where are we at? Yeah, hold on, yeah, one more time. Entrance with the cannula, there we go. Okay, we're going to go right to the edge, sorry, of the corner of the lip, bear with me here, and just give him a little support there. Okay, now that was right to the corner. Now I'm going to go to a little bit lower into this, what we call the marionette area. And that's this triangle here to give support to the chin, mouth, and fold, because that starts to recess as we age. It's a weird feeling. I always tell people it's not the best. We're going above his chin. You see where my cannula is. See where the cannula is, right there. We're going above the chin. You can see, look, the volume. We're just volumizing very slowly that area. We're going to make it even in a sec. Give him some volume there. Look to the left for me. Left. Perfect. We're going to use the cannula here. Men have hair follicles, so it's a little harder to push through the tissue. Don't freak out, you guys. Perfect, okay. So I'm going to do a light massage there, and I want to go to the other side. You can do a little Q-tip on that side for me. Now I want to go back to this other side, and you look here, look. There's a lot of support here now, and he still has this drooping here. So we're going to go on this side, which needs more volume. He was completely right. And we're going to go right into the fold on this side using the Restylane. And again, giving him some volume, all the way down to the piriform aperture of the mouth. Just going to do a light massage, very light. Okay, we're going to go back. Perfect. Grab the last syringe. Doing a total of 3 syringes around the mouth. I think structurally he probably needs a little bit more. That this will give him a nice improvement that he's looking for initially, especially with the fold. And then let's build the structure here with what I have left. So you see this little indentation here in the mouth right there. So we're going to go right there. Go on that. into that spot, sorry, right here, into that corner of the mouth. And then we're going to work our way over into the marionette area, right here on the chin. Okay, giving him some volume. Now, he does have laxity, you guys, and remember, fillers cannot be used to improve laxity, so we need to do a lift at some point or some sort of skin tightening. But for at least right now, this is going to give him some support around the fold that he's looking for. Okay. Great. Okay. So let's take a look. Let me see. Oh, that looks a lot better. Let me show you. Take a look. Take a look on here right now. What do you think? That's a lot better. So folds, chin support, and some improvement in the marionette right here. Obviously, when we do some tightening long term, we'll get a pullback, but I think now smile as big as you can. Like look, when you smile, much softer through here, a better angle where the chin is, and support around the mouth. And to me, the key here, what do you think in terms of overall folds, etc.?
No, I really like it. I think I don't see the shadows anymore.
Yeah, the shadow, exactly. And that's the thing is, you're going to get shadows around the mouth from sagging, but also volume loss. So we filled it a little bit. The next step would be, what do we do to tighten it at some point? So right now he's got to let that settle, see how the filler fills it in, and decide, do we do more, do we do tightening? We decide. The goal is not to notice as much sagging through here, which I definitely think we accomplished, and then also less recession in the chin area. Overall, the other thing is no one would look at him as a man and think he had anything done there. 3 syringes of Restylane, giving him a nice improvement around the mouth. It's going to make him have support, give him a long-term 1 to 2 year improvement there. So I think we're successful.
Yes,
good.
You said like as I just started.
Yeah, go ahead.
I'm still see.
I know, but that was the reason why I said this is a good thing to say. Is I think we need more volume. The question is,
one more.
Yeah, do we do another one or not?
Yes.
Yeah, I think we should.
Will?
Yeah, I will.
Yeah.
I think it would be good at
Because
mainly here.
I like this
Okay, good.
more than this one.
Perfect.
This one I see still.
Got
See
it.
the,
Okay, let's do it. And actually, I would like to do a little more there. So we're going to add a little bit
Okay.
more, but overall, that's the communication, the dialogue that you have to get great results. So stay tuned for more, guys.